When is a patient likely to need treatment with both Botox and fillers? Botox and fillers are used in slightly different ways when you're enhancing the cosmetic appearance of the face. Botox tend to be used particularly in the upper third of the face, in our forehead lines, our crow's feet lines, and in our frown lines. Whereas fillers are used to volumize the lower 2/3 of the face and is particularly useful in enhancing our cheeks, in our laugh lines, in these lines around our mouth that we call marionette lines, in the jawline area, and increasingly in areas such as the temple. What can you expect when you're having treatment with either Botox or fillers? Well, listen to the experience of one of my patients who has gone through these two treatments.
My name's Nicola Breeze. I'm here to have Botox and fillers. And the outcome of that, I hope to be a little bit more relaxed around the facial lines and to be a little bit more youthful, and obviously for my self-preservation and feel a little bit better about myself. To be honest, I'm not usually one to experiment. I don't like taking paracetamol, never mind having injections in my face. So that was a big step for me to overcome. I want to look that little bit more fresher around the eyes, especially the burrow lines in between my nose and the forehead. They must go. I don't want to look as though I'm frowning when I'm not even frowning.
As you can see, these treatments heavily involve the use of needles. I want to highlight, therefore, that it's very unrealistic to expect that you will have either of these treatments with absolutely no bleeding, no redness, no swelling, or possibly even bruising. Bruising can be particularly annoying because bruising in injected areas can result in bruise stains on the skin which last for up to 2 weeks. So it's very important to plan these treatments well around social activities. And it's very unwise to be preparing to have a wedding and having these treatments even within 2 weeks of such an important event. So planning is essential. The effects of these treatments can last for several months, with Botox injections lasting for 3 to 4 months and the effect of hyaluronic acid fillers lasting for 6 to 9 months. There are other fillers on the market which can last much longer, offering periods of 1 to 4 years in some cases. However, the most commonly used filler, hyaluronic acid, typically lasts for up to 9 months. After you've had Botox injections, don't expect to see the full effect of the treatment for at least 2 weeks, although many patients report observing some changes as early as 4 days into the treatment. Interestingly, I have noticed, and many other practitioners have noticed, that if patients use Botox repeatedly over many years, often they require treatments less and less frequently. And this is likely due to the reduced facial expressions that are occurring between treatments, resulting in the slower development of facial lines.
2 weeks later, I'm over the moon with the results. The forehead have completely erased the lines, a lot softer. The crow's feet around here too seems to be softer. Really impressed, really am. No, I'll tell you what, most of them said, they see the difference around the mouth area, and they was like, oh, you had a sad face before, and you're not looking so sad no more. So that was a real positive, yeah.
So that was Nicola's story. However, Botox and fillers are only one small part of a huge list of things that we can do to ensure that we always look our best. Very simple things like avoiding excessive sun exposure are very, very important in ensuring the best appearance of our skin as we age. And of course, there are other means of enhancing the texture and quality of our skin through lasers or chemical peels, or the effective use of available cosmetic products.